Good afternoon. This is Simon Schwartz, Associate Director of the Colorado ASC Association. And today I'm with Casca's legal counsel, Jim Miles, for a Shorts with Schwartz. And today is round two. Today is round two because unfortunately, last time we had a wonderful conversation. But being new at this, I forgot my cord and the microphone was not working. And while we had a great conversation about technology, healthcare, where do we see things going, we'll get back to that because I think the points that you brought up, Jim, in the last conversation about innovation and how ASCs and healthcare in general are impacted by technology, I think it's important. But what I'd like to start our conversation out with is finding out from you what, in consideration of the current politics, the policies both on a state level and then politics as we're seeing with locally election or voting submission recently. What's your gut feeling locally, politics, and nationally on politics of where things are at right now?
Yeah, thanks for having me, Simon. Good to chat. Locally, I think things are in a pretty good situation for ASCs. I think the work that Casca's done through the legislature, through clinic visits, or sorry, not clinic, ASC visits, that's paid a lot of dividends. And yeah, even though we have term limits, I think the consistency in doing that has really worked out well. That's helped a lot locally. I run across legislators in various situations. If Casca comes up or ASCs come up, they have pretty favorable things to say. So whatever you guys are doing, and I'm not the one leading that charge, but whatever you guys are doing on that front, I think is helpful. And I think everybody locally in politics, for the most part, understands that ASCs are a high value proposition in the sense that it's good outcomes for lower cost than things that can be done in a hospital setting. I know the Medicaid reimbursement is not what everybody chases, but that is emblematic of the fact that now we have a lot more codes turned on, and I think that shows where things are at in terms of an ethos, even though that's not the dollars, the higher paying patients. It's emblematic of how the state government, both on the legislative branch and the executive branch, sees ASCs.
So we could say in current terms that would be trending, right?
Yeah, trending positively, or at least maintaining, because a lot of this work's been done over the last few years, and I think sustaining at a good level. Nationally, I'm sure a lot of the members track what's going on through the National Association and those materials. But I think, again, similarly, I think trending positively or holding steady, although it was now what 4 or 5 years ago that we had some additional major codes opened up by Medicare for total joints and cardiac, and we haven't seen any epic shifts like that since then. We have made more headway as well, and it's just not as dramatic, but on a year-over-year basis, the number of available codes is going up. And what you're talking about with technology a bit ago, that obviously explains to some degree that those types of procedures can be done safely in an ASC, more safely than they could have been done perhaps 15, 20 years ago. I think technology is going to continue to benefit ASCs and allow the migration of procedures out of hospitals into ASCs. The hospital only code list is shrinking and will continue to shrink over time.
So just a quick question before we get into technology, innovation, AI. We just got back from Washington, D.C. A handful of members of Casca's leadership head out there with ASCA for their National Day, quote unquote, of advocacy, even though it's two. Does efforts that happen on a state level impact a national level?
Yeah, I think they do. I think though what in large part will drive more available codes on a Medicare basis is actually the private payer sector. That's really what led to pushing Medicare to open up those total joint and cardiac codes because commercial payers were already paying for those. They're already being done successfully in ASCs. So I think it's a lot of times in healthcare, of course, the commercial payers follow Medicare, whether it's reimbursement trends or various things, what's covered, what's not covered. But in this instance, and I think this we'll continue to see this with ASCs, the commercial payers are more innovative or flexible on average than Medicare in terms of available codes or what they think safely can be performed in a setting, clinic setting or ASC setting. And I both OBL, clinic setting and ASC setting. We're going to continue to see the private sector commercial payers probably drive that code, available codes, what codes could be APC codes in the ASC setting. And I don't think that's going to change anytime soon. Working with members of Congress federally is terrific, and those efforts, I think it's just a must do, right? You can't not do it effectively and still hope to have an impact. But when you get down to the level of like what codes are available, that is pretty well beneath the radar of your average congressperson. So you're really talking about MedPAC, CMS itself
Yep.
at that level, and so those sort of it's not classic lobbying of Congress. It's really lobbying of CMS and MedPAC. And yeah, of course, it'd be amazing. It'd be much better if ASCs had a seat on MedPAC. That's long overdue. It needs to happen. And,
We're in agreement.
yeah, and it's ASCs are now such an integral part of the ecosystem for healthcare that it doesn't make sense that they're not represented.
So I wanna pivot a little bit, but I think it also falls into this technology because I think, when we talk about additional codes being added, when we talk about innovation, we have things like AI playing a lot of key roles now, whether we know about it or not, in structure, whether it's business or who knows what can be done from a clinical standpoint. You talk about drastic differences, and my brain goes to where does this new technology take healthcare in 5 years from now?
Yeah, yeah. So I think that from a macro level, increases in technology through AI or just more evolved science, like if you think of like genetic modification, CRISPR. So it's not just AI, it's a lot of things going on the genetic side or nanotechnology side that it's going to cut both ways for ASCs, right? I mean, yeah, AI really, I see AI as increasing the pace of technological advances. Is you can analyze data more quickly, you can capture data more efficiently, and with data and the analytics that go into it, you'll be able to accelerate the pace of discovery and new technologies. So I think that will help ASCs, right? Because again, I think some of that will play into that situation where now we have a new technology that may be an implant or something else that allows something to be done in an ASC setting that historically had been done in a hospital.
Yeah, I'm smirking on this side, Jim, because you're saying these things, but like I think to myself, and what's humorous is when we're then going to engage with government and we're dealing with technology that doesn't involve emotion, right? And it's just pure logic. What happens when government and policy are receiving this and they don't like the information? You're saying it's analytics and data. What if they're being told, hey, all the things that these people have been saying for the last 15, 20 years, kind of got to do it. And they've been resistant thus far, you know? At what point does the resistance fall?
Yeah, well, if the US is serious about decreasing the total healthcare spend or decreasing the Medicare budget or something like that, it will be, in my view, it'll be unavoidable the they'll have to embrace the technology. And so I think, but again, back to the technology, I think it's gonna help ASCs in some ways, but it could also decrease the number of procedures as well. Like AI is going to benefit pharmacological science as well, right? So AI, the AI solutions or that robust ability to analyze a lot of data and run the analytics on it in a very fast manner with AI and supercomputing. That could also, there could be procedures that are being done in an ASC right now that, oh well, now there's a pill you can take, right? And the same thing with genetic therapy.
Mm.
That's probably more going to affect like oncology and things like that. Use of genetic modification where you're modifying your own genes so that they attack cancer cells or something like that, which is CRISPR, right? I mean, that may not have an impact on somebody needing a knee replacement, right? But it will have an impact on the healthcare setting overall.
Correct. And what you said beforehand is, we can't necessarily even conceptualize what the possibilities are in the future related to some of this stuff because it just doesn't exist.
Exactly, yeah. And so from that perspective, everybody's crystal ball has a lot of cracks in
Yep.
it. But I think it's safe to say on a very, very high level that technology is both going to benefit ASCs and be also a headwind to some degree, or maybe, affect volumes specifically, for certain types of procedures as well. So over the long run, I think it's going to cut both ways. There's a ton of money going into AI, and
It's really being invested and promoted in every part of life now. One of my friends has one of those refrigerators that has the built-in touch screen computer in it. And the latest operating system update implemented an AI feature where it keeps records of the things that you buy, and it lets you know because it's connected to the internet that because you shop at King Supers, by the way, your milk is on sale this week. Click here to clip your like that's a so
yeah,
yeah, I mean it's not going anywhere.
no, and although everybody's really concerned about data privacy, and I think should be to some degree, like that's a great example, right? Like of, well, do you know that that's really they know when you buy a carton of milk? And then, if they still have RFID chips that they can insert into some products, which they're doing on their packaging, then that tells even more to that algorithm that then gets uploaded. But to me, it's
Yeah.
like people should be worried about data privacy. But it reminds me of when we first got the internet, right? And the click wrap, right? Where how often does anybody read the data privacy policy?
Yeah.
Everybody they want the information and they just click
Well,
accept, accept,
I
accept.
don't know if you saw the Netflix, there's a Netflix show, Black Mirror, that the whole idea behind it is that they base it on a character who's a real life person and they clicked the accept, but of course they click the accept. They want to watch the movie program.
Exactly. No, I mean, lawyer. I'm a lawyer, and I don't even read that stuff. So, so I think although we should be concerned about data privacy and regulate what the holders of the
I just
data do.
prefer to live an incredibly boring life so that my data is not even interesting.
Yeah, I'm with you. My only social media is LinkedIn, which is, my kids think is pathetic. But anyway, yeah, no, I think the same, and back to your comment about the vendors
Yeah.
and their involvement. I mean, yeah, absolutely. And I think one of the things we're already seeing is that, like, for example, on the cardiac stents, and that's been the biggest change in the ASC world, I think, over the last 5 years, is the advent of cardiac investment, and also the manufacturers are now buying cardiology practices, right? Because they want to have that vertical integration where they own the device that's being implanted, they own the physician group, or at least part of it, that's, implanting the device, and then they want to have ownership in the surgery center and OBL.
It's the
It's a vertical play.
benefits of capitalism.
Yeah, and so the device manufacturers, um, they're and you saw the same thing with Stryker,
Hmm.
when they started acquiring certain orthopedic groups, or affiliating with them in ways they hadn't done before. So yeah, that's here to stay too. I think so much of what is being done on an R&D, research and development perspective in durable medical equipment or implants or new procedures is it's R&D is expensive, and they're definitely looking at that sort of vertical play where they have they're not just selling a device, they're trying to capitalize on the revenues at each step. And I don't know if that's necessarily a good or a bad thing. It is what it is. Overall, I mean, we're not, if anything, I think if you sort of average it across the entire healthcare spectrum, we're seeing increased uh, quality of care.
That's great.
Yeah, and obviously you have pockets where that may not be the case or outcomes have declined. But the bigger issue right now, so I think that's trending upwards. I don't think that's solely because of tech. I think that is also a focus by the providers, emphasizing quality of care, understanding that we've been talking about value-based care. Everybody's kind of tired of that word, right? That's been around now for 20 plus years, but we're actually starting to really see it now. And people don't want to call it value-based anymore because that's almost a tired word. But outcomes-based reimbursement is what I'm hearing more. And I think providers over the last couple of decades have started to focus on outcomes a lot. Not that they neglected those previously. I just think it's become more of a focus area, and so I think we are seeing like higher patient satisfaction surveys, better clinical outcomes, kind of across the board on as an average.
Mhm.
I think the bigger issue that we're seeing, of course, the bigger problem than quality of care. We have pretty good quality of care in the U.S. I think the bigger issue is access to care, especially in rural areas or for certain populations, and access, or sometimes people refer to it as equity within healthcare is sort of a new focus. That's that is, and there's a fair assessment of that. You've seen whether it's critical access hospitals, physician groups, even ASCs, there's been a decline of access to services, especially in a lot of rural areas of the country.
Well, I think we could probably spend a whole another short talking about access to care and equity of care. I would tag along with that because maybe we will have another conversation that another big impact is workforce shortages. You talk about access to care, but if a physician or a surgery center is having trouble accessing staff people, they're not able to open their ORs or have a full schedule necessarily. So I think between those two bullet points, we could probably talk for another hour about those, but I don't want to take up too much of your time. It is a gray but Friday afternoon, and I hope that you have a wonderful weekend. And Jim, again, we appreciate the captaining of our ship as legal counsel. I cannot speak highly enough about what you provide and how you provide for our organization. And for those members who need any legal help, we always suggest to reach out to Jim, and you can reach out to the association for his contact information. And again, thank you so much for the conversation today and look forward to more in the future.
Yeah, thank you as well, and thanks to all the members. I really understand what you guys do is difficult, and very a labor of love in a lot of ways. And so really appreciate what you guys do and appreciate the association as well. You guys have always done a great job.
Thank you so much.